Safeguarding at Leeds and York Partnership NHS Foundation Trust. Safeguarding is everybody's business. If you become aware of a child or adult being abused or at risk of abuse, either by witnessing it yourself or by someone telling you about it, you have a professional and moral duty to act. By doing nothing, you may even be culpable. You may also need to respectfully challenge service users, their families or other professionals to ensure you have all the information required. Within Leeds and York Partnership Foundation Trust, there is a dedicated safeguarding team and a number of trained coordinators who will work with you and your team to ensure that the person or persons you are concerned about receive appropriate protection in line with safeguarding protocols. Children at risk need to be referred directly to the local children's social work service and the safeguarding teams copied in. It is very that child and adult safeguarding is a multi-agency process and is most effective when all involved agencies participate in protection measures put in place for anyone at risk. The Thinking Family, Working Family protocol available at www.leedslscb.org.uk gives guidance to anyone working with children or adults where there is domestic violence and substance misuse, mental health issues or learning disabilities. Each of these areas of vulnerability need to have effective joint working in place. Abuse can take place in any setting, at home, in someone else's home, or in a residential or nursing home, in a day centre, adult education centre, or other establishments, in a hospital, at work, or in a public place. If you have a concern or evidence that a service user or their child is being harmed or threatened with harm in some way, then please contact one of the numbers or email addresses. The list is in your office. If you are not able to speak to anyone from the team and you believe there is an immediate serious risk or harm to a service user or their child, or that a serious offence has been committed, you should call the police on 101 or 999 and ask for the police safeguarding team. LYPFT safeguarding policies are available in the policy section of StaffNet, and further information can be found on the safeguarding pages. There are numbers listed on the posters at work. You should make notes of the time, place and people. When you have reported this, you should have a reply within 7 working days. How do I tell someone? Tell your manager and they will tell you what to do next. If you think this is not good advice, you should tell their manager. If you cannot do this, you should contact the most high up person, HR, union or occupational health. You should use the whistleblowing report form, Appendix C, when telling someone. what will happen? We will look into it and we will tell you who will be doing what. We will send you a letter. If you have a conflict, you should tell us at the beginning. You can tell your union at any time. Confidentiality. If you are telling for a patient or service user, we'll make sure they are safe. We will try and keep it confidential, but you might have to give evidence. What managers can do. They need to protect the staff involved and the patient. You must do something quickly and tell the person within 7 days what will happen. You can ask the staff to contact their union. Help from outside. You can contact the Health Service Commissioner, brackets Ombudsman, the Health Service Commissioner can look at things that are not about health. You can also contact the Mental Health Act Commission. Health Service Commissioner can be contacted on from the 1st of January 2012, the Royal Mencap Society can be contacted if you are not sure what to do. They will give independent and confidential advice. There's a number here as well. Public Concern at Work Helpline can help, but they do not work for the Department of Health and do not work at the NHS helpline anymore. The number is on the poster. There's a whistleblowing flow chart.